So we're really excited about getting involved with Electron Plus and getting the machine. Steven has definitely been talking about it, and so we're really getting our clients like excited about it, and we're just really hopeful of what that's going to do for our practice. So, in to build some momentum for this, take some of these questions that I have for you and put them out on social media, and also so when I'm talking to people, I know how to explain it. Because
Okay.
that was an issue I ran into the other day. I was at a networking event and someone's like, "Oh, that's like a tens unit, isn't it?" And I'm like, "I don't even know what a tens unit is." And then I realized it was like a STEM machine. So we'll get to that question in a second. I would love for you to start off with, introduce yourself, your background.
Okay. My name's Simon Billingham. I'm a chiropractor. Been a chiropractor for 25 years now and really switched my practice. And I actually ended up giving my practice away back in 2017
Okay,
because of all the results I saw on my table with this technology.
that's
So it was so profound that I didn't know the research, but I saw these things happen on my table. And then I went into the research to explain what I saw on my table.
yeah.
So I'm a very much results based chiro. I'm not a kind of a rack 'em crack 'em type thing and see you over and over again. I was one of the guys that looked at technology and I wanted to do things faster, help
Mhm.
people faster. And then, once you help them, you release them and then they'll
Yeah.
refer people rather than just drag it on and stuff like that. So I always looked at manual therapy techniques, a lot of soft tissue work, not just adjusting. Adjusting the spine, yes, it's a great modality, but I worked a lot with athletes and with soft tissue and soft tissue injuries, you had to have a skill to be able to deal with that and not just manipulate bones all day. Okay, so I
Right.
blended techniques, rehab, and all this type of stuff. I've used laser in the past, all the tech, shockwave, which is getting big right now, red light when it was back in the day. So I looked at the nervous system. And so back in 2015, I was looking at shoulder replacement surgery for myself
Oh, okay.
because I just kind of destroyed
Oh
my
no.
shoulder. I was a tennis player and just
Okay.
years and years of just working on people, digging on people. And it got to a point where it was just bone on bone. Okay. So I got introduced to this type of tech and I was blown away. The first time I got treated, like something in my head clicked. I was like, man, I think I've found something for my shoulder. I had done stem cells, all the manual I could think of, all the exercise, prolotherapy, all this type of stuff. And it was very much temporary. But as soon as I got worked on, there was something in my brain that told me, I think I found something.
And you definitely did.
Yeah, and when I so looking back, so the next day I was super excited. I was like, hey, I want to get treated again, but I didn't. And then I talked myself out of it. Yeah, it's like a TENS unit or a STIM unit. I've done that, all the time. It's just going to be temporary, right? So I talked myself out of it. Okay. Until it was like 8 days later, I go into the gym. And at that time, I could only do a little bit of the weights I could do. But I noticed not just decreased pain, but function improved. Okay. So
Okay.
I would do a seated row and I would have a tremor.
Okay.
And that day, I was just solid.
All
And
right.
I could do it slow. I could really contract my rhomboids and retract my shoulder blade. And I sat there. I was like, what the hell happened? And I thought, well, a tremor is abnormal electrical signaling from the brain to the muscle. The messaging is faulty. He's smoothed it out with some sort of electricity. So
Okay.
that's where
Huh.
I dove
Wow.
I dove in. And at that point, I was hurting at the end of the day, couldn't sleep at night, just the wear and tear of my body. And slowly, slowly, as I started to work with the unit, I began to sleep. I didn't play golf for 5 years. I was able to hit balls at a month, better, but not quite there. 3 months, I was
Sure.
able to hit balls. So it got me
Wow.
10 more years out of my shoulder. And this is like bone on bone, right?
Yeah. Yeah.
So what happens was when you use the technology, you're waking up the muscles, the supporting muscles of the shoulder, because muscles absorb impact. Muscles protect the joint. So that's one of the reasons why you get arthritis, is because the muscular system is not functioning, and it's not absorbing impact, and all that force goes into the joint, and that's where you get the bony changes, the arthritis, that when you look on an x-ray, you can see that stuff. So for me, it was life changing, right? And then I saw the people on my table, the tremors, you might have seen on the Instagram.
I was just gonna mention that woman who is drinking from a water bottle and it was like all
Yeah,
shaky, and then she just like took it. I'm like, whoa, that's wild. Like,
yeah, where you can start to calm the nervous system down, right? So that was my passion. So there's the original video of David who's drinking the water. And my wife saw that and she goes, "What if this could have helped your dad?" And that really struck a chord, because my dad had passed away probably at that time 4 years prior, because he had a cerebellar degenerative process,
yeah,
right?
I read that on your about page. I'm so sorry.
Yeah. So
Yeah,
that was, and I would see these results, and I would have patients come in. I'm like, "Dude, I don't know if I can help you, but let's just try." And they
yeah,
came back, "Yeah, I feel better." I'm like, "Really? You're better?"
like that's it.
So so I had this crazy idea with my wife. I was like, "Hey, I want to start this company. I'm going to give up my practice, because I wanted to be able to help more people, to kind of teach what I had learned on my table, and it was just so much easier. My practice went through the roof, and because building a practice, you go through the ups and downs of trying different gimmicks to get people in the door, and this was so much easier. It was just like, yeah,
Yeah,
I can touch here, touch here. We need to wake this stuff up, and they got better.
that's awesome.
Yeah.
I love that. Definitely with Armored Massage, like we have the same philosophy. Like we don't want to just get people on monthly memberships and have them come back for the same old thing. Like we really do want people to get results from the work that we're doing. And I know Steven does a great job. He gets tons of great reviews of people saying like this is awesome. So we're really excited to like build on that with the technology, because we also want to be advancing as technology grows. So that's awesome. I would love to know if you had one sentence that you wish everyone knew about Electron Plus, what would that be?
Our like tagline is the power of human touch with technology to magnify the response of the practitioner. Okay. Because the technology is nothing without the practitioner, right? We have such amazing practitioners. So anybody out there that wants to experience it, they can go to our website and find a passionate provider. And that's who I'm looking for. I'm not interested in just selling machines to whatever, because it needs the practitioner to have their skill, their brain, their frequency, their passion to help people. The machine is just a tool that magnifies that response, right? So that's just what I've learned from the years of talking to different practitioners. I can generally tell whether it would be a good fit, right?
Yeah. That makes a lot of sense because as a business owner, like taking a little bit more of a business perspective of it, like you're protecting like the brand. And if a bunch of practitioners that get it and don't see how powerful it can be, it's gonna like weaken the brand, but also like the product. So it's really important to keep that in the hands of people who honor the technology in the way that it should be, so that way it keeps the momentum, the hype, the use of it at the quality level that it should be at. I know Steven was so nervous. He's like, I hope that I count. Like, I hope that I qualify for this. And I'm like, babe, like your mission and his mission from what you told me sounds the same. Like I wouldn't be too worried about it. Like I think you're an ideal candidate. And he was so nervous. He's like, I really want to get this. So
Well,
I'm like, as a business owner, I totally understand what he's doing.
yeah, and I think, in this day and age, it's not enough to have a great product. You have to have the community around it, and that's
Yeah.
what kind of developed organically.
You know how many businesses like struggle to get that to happen. The fact that like it happened organically is incredible. I work in branded marketing and people strive for that to get hype about what they're building. And so the fact that it happened organically, I feel like really speaks to what you're building, but also the technology itself. Good job. Just from like a business perspective, like good job. That is not easy to do.
Yeah, I mean, because I'm a practitioner first.
Yeah.
You know, I never thought I would have a technology company. And so I come from that perspective and I know what the problems are as being a practitioner, how to get people in the door, getting good results for people and growing it that way. So my understanding of what Electrons Plus was about, it was like, hey, I got some cool technology. I can start this company. I want to help the person on somebody else's table. And then practitioners was like, oh, my schedule's super busy. And then I was like, so I'm actually helping the practitioner with their business.
Yeah. Yeah.
And then having the community to support the practitioner, where it's so cool that, as a practitioner, sometimes you're a loner, right? You're doing things on your own. Everybody's gone through their ups and downs in practice, and you could just go on our group messaging and say, hey, I got somebody with this problem. Has anybody had a result with this? Or, hey, I'm having a little bit of business issues. What do you guys think? So they can have a sounding board of how to actually grow their practice as well as the clinical side to helping people on the table.
Because I think a lot of times it's so easy to see someone who works in a similar field and view them as competition. Anytime I meet another graphic designer or, another massage therapist, I always have to say, like right out of the gate, hey, we believe in opportunity, not competition. And we figure out like what's their niche, like what's their specialty, and how can we complement each other. And for my own business, for prior design, I do graphic design and marketing for technology companies. I say like I specialize in tech. And like someone else is like, I specialize in oh my gosh, what was it? Nonprofit. And I'm like, okay, great. Oh, so we have our thing. And same with Steven, like because in Kansas City, we specialize in sports massage therapy and rehab, and recovery is the word we're always preaching. Like we are here to help people recover from whatever that might be, from whatever accident, injury, what have you. And so it's really helpful to differentiate ourselves so we can build a community that isn't like, hey, we're trying to squeeze everyone out. It's like, how can we complement each other? So I think that's super, super important because, like you said, it can feel kind of lonely otherwise.
Yeah, our community, they refer back and forth. They're
Yeah,
like,
that's
hey,
awesome.
who's over here? I have a client that's traveling and whatever. And so the community, they share techniques and stuff like that. So having that grow organically is just kind of amazing.
Yeah. Well, I'm going to try to focus some of these questions on more how it's going to help individual clients versus helping the practitioners. And so, keeping that in mind, how would you describe to like a client, not a practitioner, of what is the difference between the Electron Plus and a TENS unit?
Okay. So TENS unit is what we call analgesic. It helps with pain, temporary reduction of pain. Okay. But it doesn't heal anything.
Okay.
Okay. So they use a theory called the pain gate theory, where the TENS machine kind of taps on the nerve, a sensory nerve. And after a while, the brain says, oh, I can ignore that. I can ignore that pain signal. That's why you get a temporary reduction of pain. Okay. So this is how I explain it to patients. Our bodies are a battery system. As
Yeah.
we age or our health declines or we have an injury, there's a drop in voltage in the cell. In order for us to heal, we have to increase the voltage of the cell, i.e., put electrons in, so that that cell has more energy to produce collagen, anti-inflammatories, whatever it needs to do to heal, to replicate, right? So that's where the healing response is. You see bruising heal so much faster.
Yeah.
Okay.
That's
So
interesting.
yeah, so that's the difference. It may feel kind of that tingly sensation, but the healing response you get with Electrons Plus is totally different.
Gotcha.
I try to show like there's a field that comes out of that machine where we can use a sound we convert that field to sound, and the field comes across like 6 feet. So I can take this tool and I could just move towards the machine and it'll beep when it feels the field, right? Or
Oh,
we can,
okay.
or a lot of the practitioners, they'll take a light bulb and they'll just put it over the machine and it'll start to light. So you have this field that comes across. Like I can
Yeah.
touch you, transfer that energy, and I can just reach for the machine, and I don't even have to touch the machine, and you'll start to feel that energy field.
Whoa.
Okay, so
Whoa.
I'll teach Stephen how to do that to actually
Yeah.
see. Hey, this is different. There's a field coming out of here,
Yeah.
right? So
Well,
that
when
that
you do that, we're absolutely going to record it so we can share that. That's
yeah
really neat, especially with the light
yeah
bulb, since people the sound, but that's really neat.
yeah. It gets the because it helps patients understand. Hey, you're we're gonna light you up like a light bulb. We're gonna
Yeah.
charge your cells, right, to facilitate that healing response.
Yeah. So how do you not feel an electric shock?
If one side is charged, like say, so there's a plate is on the client or the patient. So when you turn it on, they are charged. So let's say this is their body, and I come in with a pinpoint and I hover, you'll see a spark.
Okay.
It doesn't hurt.
Okay.
It it surprises you, it shocks you, it surprises you, but it's not damaging. Okay.
Okay.
So if there's a gap, the electron will jump. So how we connect is a flat surface and we connect quickly. So now the charge is running through both the practitioner and the client on the table. And then you can start to manipulate that and guide, because we call it guided PMF, we guide it into the tissues. And when the practitioner is skilled, they can actually feel the resistance in their fingers. And that's where you need to charge the cells.
Gotcha. Gotcha.
And
Okay.
you can show somebody where the problem is, because healthy tissue or healthy muscles, when you send that charge through, it will twitch and contract. They'll feel a lot. They'll feel the
Okay.
tingles, they'll feel the contraction. When the contraction's strong enough, it will move the joint. So if I touch your forearm, you'll start to twitch your muscles. Okay.
Okay. Okay.
So when you come across a damaged area, an area where it's low voltage or injured, you touch it and they'll be like, I don't feel anything. And then you put it to the good side, boom, it fires. So you can
Huh.
show a client, look, you feel the difference?
Yeah.
So
Okay.
as
I
a
like that so you
clinician,
know something's actually happening versus like,
yes,
oh, it's happening, but you can't feel it or see it.
I could explain it and they could feel the difference. I didn't have to like sell them on anything. I just show, they feel, and then hopefully, depending on how good their battery system, that muscle starts to contract and they come off the table like, oh my God, it feels different, right? So then, yeah, I don't have to say, okay, you need to come back, blah, blah, blah. They usually say, oh, when do I need to come back? Because you've shown them a result.
Not to give a silly analogy, but do you remember like those toys in like the 90s where it was like a bulb and it had like all the electrical currents and you'd put your fingers on it and it would follow
Yes,
your fingers? Is that
exactly.
similar? Oh,
Exactly.
exactly. Oh,
Yes,
cool.
yes. So this is
Cool.
kind of really old technology with Nikolai Tesla. If you go in the history books where he's lighting a light bulb, right? Or he's out there, I think he's reading a book and he's in a cage, a Faraday cage, and there's lightning storm, and the Faraday cage blocks that electromagnetic magnetism,
Yeah.
right?
Yeah.
So yeah, that's kind of where it comes from. It's the
Okay.
Earth's electromagnetic field that is healing to the body. Nowadays people EMF, yeah, that's very high frequency, the cell phone towers and stuff like that. But this is like very low frequency.
Okay. Oh,
That's
that's good to
that's
know.
the difference. Yeah. So, I'm not a huge fan of the pulse electromagnetic field, EMF, because people think EMF is bad. No, no, it's the low frequency. So
Gotcha.
that's kind of where there's a little bit of confusion.
Sure. Yeah. But that's okay. That's why we're talking about it.
Yeah, yeah. So yeah,
Cool. So, is there any like type of client that you see most often and that get the most benefit?
yeah. So we have I was a meat and potatoes guy. like sports injuries, mechanical joint muscle stuff.
Yeah.
I saw muscles release faster, heal faster, waking up the joint for like joint problems. Oh, sorry, waking up the muscles to help support joint problems. So sports injuries, your normal aches and pains, all that type of stuff. And then I would hear things like, "Oh, what'd you do? I slept great last night, after treatment. I'm not fighting with my spouse.
Wait.
Yeah. Oh, I'm not, my digestive system is better." Okay. So if
Yeah.
you trace all that stuff has to deal with your nervous system. So you'll hear buzzwords these days with like vagus nerve stimulation. You have your nervous system, your sympathetic nervous system, which is your fight or flight system. You're looking for the tiger, okay? So in our society, everybody is sympathetic dominant, okay? So when I tell you like I'm not fighting with my spouse, okay? Let's say your sympathetic dominant is so high and your spouse says, clean the dishes, or back in the COVID days, put your mask on.
Oh my
If
gosh.
you are so high on that threshold and somebody says something nasty, boom, you blow your top, boom, you're ready to fight. Okay?
Wow. Yeah.
So
Yeah.
what we need to do is the opposite of sympathetic is your parasympathetic nervous system, your rest and recovery. So what we can do is stimulate the vagus nerve and we bring down the sympathetic and bring up the sympathetic. Your rest and recovery. That's where your sleep,
Yep.
digestion, reproduction happens.
Wow. Okay.
So
Yeah.
that's
Yeah.
that's why they use it for anxiety, depression, all that type of stuff. And we kind of have to be careful with like FDA type stuff, but they actually approved PMF for anxiety and depression. And I was
Really.
like, well, why would they do that? They're going against the drug company. We didn't go down that route. We just said, you know what? Let's show people's results. You can magnify it with Electrons Plus. You can get it done quicker because now we're using frequencies to influence the brain waves. What I saw with tremors and stroke and stuff like that, we can get very good results, depending on the battery system, how long do those effects last? And that is independent. The younger you are, the more healthy, if you eat right, you exercise, all that type of stuff, you're a better battery system. If you're a 80-year-old diabetic, kind of not as good batteries, you're not as vibrant.
Sure. Sure.
So of course, it's going to take more time to heal.
Right. Yeah.
And I use the analogy with my patients like, yeah, are you an iPhone 1? If you can find one and charge it up, it will probably only last 10 minutes.
Yeah.
Or are you an iPhone whatever they're 17? Remember when you first get your iPhone, you're like, "Oh man, I don't have to charge it for 3 days."
Yeah.
And then
As
it
someone who
slowly
had
starts
an
to degrade.
iPhone 6 SE for like years, I can like totally attest to that.
Yeah. So it really depends on the person on the table. And what we found was salt, minerals, electrolytes carries charge.
Oh
Okay.
yeah, that makes sense.
So if I find that they don't progress, and let's say it takes me like 15 minutes to get a muscle jumping, and they come back later, a few days later, and I have to start again, it's like another 15 minutes to wake up that muscle, then I know they're not holding the charge I'm giving them. So that's when we do a simple thing of taking Himalayan salt, Celtic sea salt, or whatever your favorite electrolyte, trace minerals, whatever product, that will help to hold that charge,
Okay. And by
right?
consuming it, right?
By consuming it, yeah, yeah.
Okay. You're not like
Because
salt rubbing people.
yeah, as I said, we're battery systems.
Yeah,
What do battery
yeah.
systems have? Salt, right?
Right.
It's,
Huh. That's so
you know,
interesting.
it's one of the things we got scared with salt, right?
Yes.
Medical community, high blood pressure, all these type of things. Like, yeah, that's sodium chloride, that's table salt.
Right.
But if we go to the natural salts, the Himalayan salt, Celtic sea salt, which is what our body needs to hold on charge.
Mm-hmm. Yeah.
Back to certain things, you can just relax somebody. Somebody's like, hey, I just want to relax. Yeah, you can put them to sleep on the table. Or you can do like this more serious stuff, right? Because the battery system's lower, the stroke, the post-operative stuff, right? Like the post-operative joints. Because what I saw was every time you go in for surgery, it will shut down those muscles. And what we have to do is wake up those muscles. And then
Completely
because
understand.
we actually link the brain to that muscle again, so that when you do the exercise rehab, the brain can see that muscle, can actually control that muscle, right? So pain, swelling, types of things. I mean, we've done stuff with like allergic reactions with insect bites, bee stings. You're promoting that healing process a lot faster.
Interesting.
These are just all the things that we've seen as practitioners, and we talk about these cases where, yeah, let's just send the electrons in, let's stimulate that healing process. So it can be very non-specific.
Yeah. Okay.
You know, we're not treating conditions, we're helping the
To
body, the
apply the
battery
energy source
system.
to.
Yeah.
Huh. Wow, that's so neat because when Stephen was telling me about it, he mentioned that it helps people with diabetes, and you already touched on that a little bit, but would you be willing to explain a little bit more in depth of how it can help with diabetes?
Yeah, we've had cases where they measure their blood and they're like, oh damn, my blood sugar control. A, you're working on the nervous system, bringing up the parasympathetic, right? And B, you're shaking the cells, opening up the cell membranes so that nutrition, insulin can work better. You're magnifying the response of the body. Just like when we started, all we're doing is magnifying the practitioner's touch. All we do is magnify whatever therapy you're doing, nutrition, drug therapy, manual therapy, chiropractic. All we are doing is magnifying that response by giving the cells more energy to respond better.
That's awesome.
Yeah,
That's
so
super
so that's
awesome.
that's on a basic level where if I didn't help the condition of somebody coming in, I knew that once they left my table, they were way better off because they had more electrons in the system. How good their battery system is, like, that's dependent on them, right?
Yeah.
So depending on their condition, they may need more charge time. They're an iPhone 1, so yeah, of course you're going to need more charge time. So some of the Parkinson's stuff that we've had, a lot of the comments like, well, how long does it last? We've had
Mm.
cases where it's lasted 1 day, 3 days, a week, 3 months,
Oh wow.
right?
Wow. Yeah.
Arthur Robinson, one of our practitioners, he was on a podcast and he explained, oh, the lady with the water bottle, right? He did exactly what I did with David, right? He was on the podcast. He goes, yeah, that lady, 3 months.
Wow.
Yeah. So everybody's a little bit different, right? Um,
My last question that I had written down was if people want to learn more, where can they find more information?
yeah. So our website, electronsplus.com, but most of our stuff is on Instagram. If you go to
Okay.
Electrons Plus, Instagram, we just try to show results, right? We just get the message out that, hey, these are real life cases that you can contact, whether I post it or our practitioners post, and they can search on that. If they go onto Instagram, they can put a hashtag guided PEMF or at Electrons Plus to search all the practitioners that use that hashtag, and then it'll bring it up.
Yeah, cool.
And